Be an exciting live chat. So I hope many of you are joining in today. It's a Monday night. Everybody's done with their dinners and hopefully are all joining in for this exciting session that we're going to have with Dr. Anisa. So this is Dr. Tarveen Kaur. I am a graduate from Boston University. I own my own private practice, New Age Dental Care in Pune, and I also run my Dr. Kaur's Academy, where I help recent dental graduates and also the dentists who want to upskill their dental expertise in my own in-house courses. I also collaborate with other dental professionals to upgrade the dental skills in India. So today we have Dr. Anisa and I'm super excited to join in. So let me not waste time. Meanwhile, you all can please keep adding in. Let's have Dr. Anisa join in. Dentists who are going to be online, could you please on the comment chat let me know if you are a dental student, a dental graduate, a dental intern, or a dental associate, or a practicing dentist like a dental associate, or a practice owner, because it will help me just tune my questions according to my viewers. So it'll be really great if we can have this interacting. Welcome, Dr. Anisa. It is such a lovely thing to see you here tonight.
Thank you so much, Tarvin. How are you doing? Thank you for
I'm
having
doing
me here.
great. Great, great. Super excited. So Dr. Anisa is from Bombay and we're having people join in. Like I said, let's have an interactive chat. Dr. Anisa also loves to answer the questions which are thrown to her off online. And I would love to hear from you all who all are the dental practitioners, who are practice owners, dental associates, dental students. So we can help you guide better in branding yourself. So today is zero to hero, how to create a brand that makes people walk in. So let me introduce first Dr. Anisa. Dr. Anisa is a gold medalist. Her full name is Dr. Anisa Patel Sheikh. She is a gold medalist from Nair Hospital, Mumbai. She has done masters in dental business and several leadership and management programs in healthcare. She is a certified in digital marketing and social media marketing and also a certified storyteller, awarded as a social media dentist of the year in the year 2024 and 2025 by the prestigious FAMDent Awards. She has also been awarded as a fabulous marketer at the World Marketing Congress 2024. I mean, she's got such a brilliant portfolio. I think, Dr. Anisa, you're one of the most few, or maybe I know as the only healthcare professional who is so focused on healthcare marketing. I mean, you're brilliant to give us pointers on that. I think there are a lot of us dentists who are struggling with marketing. We all are good clinicians, and we are just finding it a struggle to put ourselves forward, and that's why we're here today. So we have dental dentists online. I first want to ask you, when do you think, because you're going to have these dentists who are the young professionals, practicing owners, middle age or older dentists, when do you think they should start making their social presence first?
Okay. So to answer that, the better time was yesterday. The best time is, I mean, the best time was yesterday. And so today is you're never too late. So I feel it's always whether you are in first BDS or whether you are 30 years into practice. I think this is something which is the need of the hour. And few decades ago, when this whole thing was not there, people who passed out in 60s and 70s, our mentors and their mentors, we never had this medium. Okay, and so the only thing that they would do is they would just come out of
Rely on
college,
the word of mouth.
come out of
Yes.
college, learn their craft, and then just open up the
Yes.
door and patients would come. Yeah.
Yes.
But now suddenly there's so much noise, so many dentists, so many things out there. The customer and patients, they are spoiled for choice. And now, if you're not out there for the Gen Z, then you don't exist. So if you are not there on their devices, you practically do not exist for these people, because that's just where these guys live in. So
I mean,
the way I see
that's
it,
such a good
yeah,
point because do you see people who are waiting in waiting rooms or you see anybody on the road? What do they all looking at? They all are looking at their phones. I mean, that's where they are at, and that's where you need to be visible.
yeah. I mean, you go to any place, whether it's an airport, whether it's a restaurant, or whether you're waiting in a line, and you will find, doesn't matter who it is. It can be the most mundane person or a student or whoever, and you will see them that they are glued to their devices. So the whole thing has shifted. The paradigm has shifted, and communication has shifted online, and that is the reason I feel that this is the need of the hour. You might argue, and I'm sure a lot of people out there say that I don't get any patients from this so-called social
Yes.
media. But my answer is, you might not get a direct patient from whatever you're doing, but eventually people are checking you out. People are finding you there. People are building, the trust building happens there, the no like trust factor happens there. And if you're smart enough to use these channels well, then there is high chance that they discover you on search. So if you have done your SEO and your ads and all those things well, then there is a chance that they will discover you also through those mediums. And most of the times in our profession, if you talk about big cases, full mouth cases, implant cases, even if they are referred by a friend,
Yes.
they are going to check you completely. They are going to do the entire inquiry before they trust you with their teeth and with their money. So that's just
Absolutely.
the way it works.
So I
Yeah.
think social media marketing is not only for patients, but is also for all us dentists to see. Because let's say if someone calls me from Delhi and say, "Can you give me a referral for dentist in Delhi?" And if I'm watching my social media and I'm at it and I'm able to see other dentists in Delhi who are working, and I'm constantly seeing their work, they would be in the first people in my mind to refer my patient to, because physically I cannot be there in Delhi to see their work, but social
Yeah.
media helps me understand what they're doing and how consistent they are with their work. So it really helps in referrals from other dentists too.
Yeah. I personally have referred cases just because of the before afters I have seen from fellow colleagues. And I know, okay, this colleague of mine does amazing work and they're great with what they do. And that's how you kind of refer people. So I think it's a very strong medium. If you look at it properly, if you use it properly, then I mean, it's an invaluable medium, not only to build your brand, but to authentically connect and to find friends, colleagues, connect with people over the globe. Suddenly, the world is such a small place because of the power of social. So
Absolutely.
yeah.
So it's never too early to start and it's never too late to start.
Yeah, so recently today itself, I had a conversation with one of the participants who had applied for a strategy call to apply, and and is this the right thing for me, as in, do I build an online presence? And so many times we have people asking this question because they are not sure, especially the women dentists, they don't know, where they ultimately might get settled, and how, which country, which place and all, and they are very skeptical. Okay, what do I do? My answer is, if your personal brand is strong, okay, then wherever you are, you have a strong online profile because of which you are known. And whenever you're going to either apply to a job, to a hospital, or even when you're opening doors for your own practice, you already have a strong profile with a strong, all the things that you have mentioned there.
True, true.
Your
Which
cases are
is
there,
particularly,
everything
I
that you
think,
can do.
more a lot in India. If you see, we all recognize our doctors. We don't go by the brand names.
Yeah.
We are all actually looking for our doctor's name. So if you make your name brand and you build up on
Yeah.
that, wherever you're working would not make a difference. Am I right?
Yes, yes. Especially in dentistry, as you mentioned. So it doesn't hold true for big corporate companies because they are not a personal brand. But for us, people come to, I'm sure, like, people come to you also with your name, right? Kors
Yes,
Academy or
yes,
Dr. Arvind Kaur, right? They
yes,
don't come with New Age Dental. New Age
yes,
Dental is
they
the
don't.
brand name, but it's
Yes,
definitely you, right?
yes,
So for most of us, even people who have, like, say, a chain of 3 or 4 practices, those people also, there's this principle, the dentist or the face of the brand, let's put it that way,
okay,
under the umbrella of that phase they are coming. They might not get any dentistry done from that principal person, and that person might just be involved, say, for a 5-minute consultation in the beginning of the appointment and towards the end when the patient is done with everything.
right,
And that would be that touch point just to give that personalization to that whole experience.
yes,
But at the end of the day, that patient recognizes that institute through that personal brand. And I
absolutely.
feel that's very important in dentistry. And for all of us who are looking to do this, I think it's super important.
So now that you're talking about personal branding, I'm going to bring up Instagram. I through my Dr. Cause Academy, I've met a lot of young graduates, the ones who just passed out from college, and I also do a lot of GBT exhibitions where I get to network with a lot of dentists who come to the stall. And I was quite surprised to see there were many of them who didn't even have an Instagram account, or the ones who had told me, I'm not really active on it because it doesn't bring me patience. And thirdly, the younger graduates didn't even have a professional account. So I want to know, should a dentist have a personal account separately and a professional account separately, or can they have as one?
Okay, very good question. And this is one of the most commonly asked questions. Now, the way I see it and the way I have seen working for other guys is that you would, even if you have two accounts, ultimately you're going to lean into one account. Okay, so unless you are a super private person, okay, I mean, you can definitely have very private pictures to be circulated in family WhatsApp groups and all, but I would prefer to have one single account, have it as a business account,
Okay.
and have it all over there. In fact, when we decide the content pillars, like different types of content that you'll be posting, we have definitely one content which we say that it should be like little bit about your personal, the personal side of it.
Yes.
So I feel, yes, unless you are somebody who's, you're just putting party pictures and you're just out
When
there and
you
you're
have two
just putting
lives
that
that you
kind of
live. Yeah.
yeah. So then in that case,
Yeah.
I mean, in that case, you can either use the Instagram stories, which you don't convert it into highlight and you just keep it there, or
Yeah.
then you have a private account and like, use it that way. So yeah, I feel, and it's also if you have two different niche, okay. So for example, in my case, we have Ansh Dental, which is the clinic, and then I have my coaching profile, which is this one.
Yes.
They're two different things.
Yes.
So I have two different accounts.
Yes.
But for yeah, so but for someone, say for example, somebody who's teaching a clinical thing, okay, so for them, it makes sense for their patients also to see that they are not only doing this, but they are also teaching fellow dentists their
Yeah.
craft, so that actually improves their positioning and the authority. And I mean, if mostly you should do it together, unless if you scale to that level. Say for example, if you have your academy really scales up, and then if you have a lot of collaborations and it becomes something global, then of course
Right.
you would want to have a
Right.
separate page. But initially I would say you should have one strong coherent
Yes.
brand, and then later on, as your different businesses expand, you could definitely create more
Yes.
profiles as you go along. But to begin with, one profile, so that you can put all your energies into one and grow that one account and build a following and a community around that one account.
Right. But I think then you have to be even mindful about what
Yeah.
personal aspect of yours you're putting
Yeah.
on that line, because
Absolutely.
you will be looked and judged according to that
Yes.
as being a professional.
Yes, yes.
Yes.
And I always say this, that if you got to do this whole thing about personal branding through social media, you will have to put yourself out there, if not 100%, at least a part of you,
Yes.
because that's just the way people connect.
Yeah,
So yeah.
absolutely. Absolutely. So while we're doing this chat, all the viewers that we have, if you keep yourself interactive and you answer some questions during the comments, we have a good giveaway towards the end. So I am going to ask you a question for all the dentists who are watching. I know there are a lot of non-dentists who are watching us too, because I think marketing branding applies to all kind of fields. So there could be a little giveaway for everybody who's watching, even if you're a non-dentist. But for the dentists who are here today, because we were doing it for them, I would like to know which social media do you use? Do you use the Facebook, the Instagram, the LinkedIn, the WhatsApp features? What suits you and what are you most active on? I would love to hear that on the comment. Let's go ahead and let me ask you, Dr. Anisa. Uh, can you name what social media platforms the dentist should be most active on, and what kind of content they should be sharing? Is it different for Facebook and Instagram? Would it be different for LinkedIn? I mean, how would you help them understand what social media, and if there are beginners, which one to start with, which is easier to relate with, and then move forward?
Right. So, before you even jump into this whole thing about, which platform and all, I would say first, absolutely get clear on the who, the what, the why, and the how. Okay. As in who you are. So your bio, okay. Say for example, if you talk about your Instagram bio, your bio in just few seconds should tell somebody who you are, as in what is your niche. So if you're a dentist, what sub niche of dentist, like you are, might be a smile specialist or an Invisalign specialist or a cosmetic specialist, whatever it is. Okay, so your niche, and then you know what you do, and then what is the ideal persona, patient persona, whom you're trying to you talk to. So basically smile design for young adults or whatever.
So you
Okay,
mean the age
so
group
that
of the
part,
people?
a little bit at least. So over initially you will not know, but over a period of time you'll understand that this is my audience, this is my
Okay.
audience. So basically,
Okay.
who is it for, who is it for, what you are, and who is it for.
Okay.
Okay, and then why should someone come to you? So
Okay.
why, out of all the people, why should I choose Tarvind Kaur's Academy, or why should I come and learn from Anisa, or why should I come and you get dentistry
Yes.
done from XYZ?
Yes.
So uh, that brand differentiator, okay, that essence, if you could get it in your messaging, okay,
Okay.
which is your unique tagline, okay,
Okay.
which resonate. Of course, it's like something which you will discover once you go through the questions and you kind of think about it, and then you will be able to arrive at that line. So once you have that strong messaging,
Mm.
and then if you can build a story around it, not in the bio of course, but when you make your website, and if you want to talk about the about me section of your website, when you want to showcase your journey and the reason that you do what you do. So your about me section of your website is a great place for you to actually talk about your story and your journey, and then that will instantly connect with people. Okay, so
Okay.
on social media, that little bio which you get, whether it's Facebook, LinkedIn gives you an entire
So your
paragraph wherein
bio
you
is
talk
very
about.
important, what you write
Yeah,
in those lines, because that's the
yeah,
initial thing that people are going to read and connect with you.
yeah,
Okay.
yeah. So that thing, that once that clarity is there, once you know, okay, fine. So now, depending upon your niche, you want to put post which will be specific to that. Say for example, in our clinic, it's FMR, implants, and kids.
Yes.
So we will try to center content around that. So that would be my one part of my content. Then a lot of times I want to have one content pillar which is going to be about patients. So
Yes.
patients, before afters, testimonials, case studies, all of those things. And then I want to have some content which will be my behind the scenes content, my team
Okay.
content,
Okay.
wherein I am talking about who's on my team, what do we do. So how does the practice look like? Because
Okay.
for somebody who's watching you on socials, that patient is interested in knowing, what kind of practice it is and
Yes.
what kind
They
of
want to know
patients
the
come.
entire team and the
Yeah.
place. Yes.
And also what they really want to do, even, and you must have noticed this for yourself. Say for example, you're trying to explore a salon for yourself, or maybe you're trying to buy
Yes.
some commodity. You want to know, do people like me come here? Okay, is
Yes.
this meant for a person like me?
Me.
So that is where you want to align with that ideal patient. Okay, and when you're
Okay.
going to be talking to that persona, and then that person, so when somebody watches your website or a social content,
Yes.
they should be literally imagining themselves out there, because that
That's,
patient persona is
yeah.
matching to exactly what you're catering to. That is called as the market to message fit, right? So
Yeah.
that is what you want to portray through your content, of course, and then that would be your behind the scenes, your team stories, and all of the things that you do. So that would be one of the content pillars. And then you want to have something wherein you are including a little bit of your personality. Okay, so maybe apart from dentistry, I see that you are into fitness. Okay, so
Yes.
you often on would put some kind
Yes.
of a fitness
Yes.
video or a
Yes.
story.
Yes.
Okay,
Yes.
so
Yes.
that kind of really connects with patients, because patients know that apart from dentistry,
Mm.
what else does Dr. Tarvin do?
Right.
Or apart from dentistry, what else Dr. Anisa is passionate about,
Right.
or whichever doctor it is,
Right. Right.
So whether you're into baking, you're into photography, or whether you're into philanthropy or
Yeah.
social work, or whatever
So they
whatever your
connect with
passion
that
is.
little
Yeah.
outside hobby of yours, the ones who are also part of that. Okay.
Yeah. And you'll be surprised at what happens when next time patients come. They will actually speak
And they
about
ask.
that thing, that, oh, I saw you at that marathon. Oh,
Yes.
I, saw you that
Yes.
you were at this event, and, stuff
Yes.
like that.
Yes.
So people connect with people, and
Yes.
people want to, genuinely connect with humans. And
Yes.
that's where you get this, social gives you that extra thing where you can play with all this,
Right.
because you really can't do things like quirky things like this on a website. On a formal website or a formal email. Okay,
Yes.
but
Yes.
social media gives you that extra thing where you can just go out there and be show your other side. So
Yes.
I'm not saying that you're going to be putting a lot of this kind of content, but maybe one or two
A
posts in a
few.
month.
Yes.
Yeah,
Yes.
yeah, which showcases your personal side. That's really going to connect with patients.
So,
So I
all
think
in all,
that.
people should plan their content before they begin, right? Before they think, okay, now this is what I want to concentrate on. You should first understand what is it you're offering, what services do you want to offer. Don't go around posting everything and just let it just get confusing. So concentrate on, like see you said, FMR cases. If you're into aesthetic smile designing or you're into implants, focus on that for a while, plan your content and think how you're going to do it, and then go for it.
Your patients, corporate people, then you want to explore LinkedIn as well. Okay, so
So
that
there
is
was a
about.
question a
Yeah.
viewer asked you. She's an orthodontist, and she wanted to know how, as a consultant, she can help to promote herself online on social media.
Okay, yeah, Christina. So Christina is already working with me, and she's saying, "How will that be relevant?" Okay, so as in, I think she's Christina. You mean that if she's a consultant, right? That's what she means.
Yes.
Yeah,
Yeah.
yeah. So
Like she
when
must be
you
not
are a
having
consultant,
a practice. She's a
yeah,
consultant in different practices.
yes, yes. So the way it would help somebody like that, and I have two case studies where people have done the program who are consultants with other practices, is that now you have you're just not another consultant. You have your own personal brand wherein you're going to be having your own case studies. You have your own before afters. You have everything. Which is like almost like a, because Instagram, if you consider, say for example, it's like a mini website. Those
Yes.
highlights are the different topics which you could consider as the different pages of your website. And
Yes.
Instagram as a whole, the reels, the stories, and the posts, and all of those things, if done well, they can really help you connect. So to answer her question, that will basically help your positioning, take your positioning to next level. And the maybe when you approach a doctor or you approach a hospital, they know that this person has a lot of credibility, and there is, so basically it just helps you increase your
Yes.
brand. Maybe you get better prospecting because of your brand positioning, of course. And also overall, there is a chance that when you have a strong personal brand, patients would be the conversion rate is higher
Yes.
and the trust is higher. So
Yes.
overall, definitely it's going to be a win-win. And tomorrow, say for example, you change your practice and you go to another place and you shift your location, your personal brand is with you. So
Yes.
when you're going to be applying, you're just not applying with a paper of a resume where which mentions all the things that you do. There is enough social proof to back that resume, that okay, fine, she has done this. So when there is enough content out there, when there is enough brand positioning and enough social proof of the work that you have been doing, then obviously that takes your positioning next level. And then when you are obviously when you're talking with somebody who's probably hiring you also as a
Right.
consultant, then obviously there is a higher chance that you get a better result out of it, basically.
True. So building up your personal brand would be her answer to that.
Yeah,
So
yeah.
I want to know now, there are different kind of social media postings that we do. We do entertaining, we do educative, we do testimonials, we do interactive. So what kind of content works in which social media? Instagram, would it be different?
Yeah,
Facebook, would it be different? LinkedIn would be different? Could you help us with that?
yeah, sure. So starting with Instagram, as you rightly mentioned, Instagram, if I had to just say one word, it's entertainment. Okay. And it is infotainment, let's put it that way. Information with entertainment. If you're smart enough to do it in that way, then Instagram will be very, very happy with you. Okay. So Instagram I'm sure people are going to agree that people at this time, once they are done with dinner, they are binge watching the reels.
Yes.
Okay. Literally, I know friends
Yes.
who have
Yes.
that routine of binge watching the reels
Yes.
for almost
I
45
think
minutes, and I have seen it.
we all do it. Yes. Yeah.
Yeah.
It's the most
And then
de-stressing moment of the day.
yeah. And if you look at your own pattern, when you're watching those reels, of course, the algorithm is going to show you what you're going
Yes.
to already watch,
Watch.
more of that.
Yes. Yes.
But also, even say, for example, if you're watching dental or healthy related content, you're not going to you're not really going to watch something which is giving you a lot of information. You're out there for entertainment. You're out. It's like a stress buster.
That's Instagram.
So you want to,
Yes.
yeah, you want to just connect and entertain, and at the same time give some information. And the
Yes.
funniest and the best part of it is, every time you scroll through that content, there will be sponsored ads which will be coming in.
Yes.
Okay, and again,
Yes.
those ads are curated depending upon what you're seeing. Okay,
Okay.
so that way, if you flip the side and that way, say for example, if you're a dentist who is running ads also, apart from your organic, you are also doing ads. So then there is a high chance that, because that target patient is scrolling through that kind of content. Say, so for example, somebody is looking through aligners, or maybe the child is going to go through aligners, and now they are looking for that information. So
Right.
when they are looking for that, then there's a high chance that if you have done like a targeting well, you will get a sponsored ad of an aligner.
Okay.
Okay, and because you have done you're consuming that kind of content, and now you're a clinic who has done both organic as well as paid social, and if you've done all the right things, there is a high chance that that ad converts and somebody looks,
Okay.
discovers you. When that person discovers you, most of the times what happens is, whoever's running ads, the profile has nothing,
Yeah.
so nobody connects. But
Huh.
now,
Right. So it
if
has
the
to match with your
yes,
reels. You should be having good content even on your homepage because that's where they're going to eventually land up.
yes. So when now from an ad, now I'm coming to an account, and now I'm seeing, okay, fine, I have stumbled across this account, and now I'm seeing, okay, Tarvin is great. Her work looks great. Oh, she's doing, I'm seeing the before afters. I can
Yes.
see testimonials where the
Yes.
patient is literally emotional after giving
Yes.
the crowns or whatever. So
Yes.
then obviously, the entire selling is actually subtly happening
Yeah.
online.
Yeah.
Okay, so basically the no like trust factor is building. I'm connecting, and I mean, that's just the way it works, because humans will connect to humans. So
Absolutely.
if you're using it well, then it's going to give you an ROI. That's what
So
I have to say.
that's what I say. I think you put content which people connect to. Don't do
Yeah, absolutely.
hard selling. Don't do ads which look like you're selling a product because we're not selling products. We're
Yes,
selling services. And we're
yes,
actually doing services. We're not even selling services. But
absolutely. And
don't
and
make it
and I
look
would
like
not
you're
even say
selling.
we are selling. We are
Yeah.
not
We're
selling
not,
services. We are
not selling.
transforming lives. We're
Absolutely.
transforming lives. Yeah,
Absolutely, absolutely. So, as
yeah.
practice owners, I'll tell you, as dentists, practice owners, we have so many roles that we have to play. We have to do the accounting, we have to do the running, we have to manage our staff, the appointments, the clinic work, and plus now we have the social media pressure. What happens is initially you feel like, okay, after this chat today, many will be enthusiastic, which I'll be really happy they will be, and they'll say, let me get back on social media, let me go and give it a try. They will go ahead and try. They'll make a few reels, they'll make a few posts, they'll put it online, and they may not get that much engagement. They may not get that many responses. And then I think it becomes very disheartening for them because they're putting a lot of efforts and time into it. And when they don't get a response, slowly, as humans we start going away and we go back to our shell again. What do you do in such a way? What advice can you give them? And for these people who are going to get into social media now, who's going to try it now, or who have failed before and now after this chat would want to go for it, how would you want to help them out with that?
Okay, so I feel the overwhelm happens when you are doing on the go stuff. Okay, as in, like, you don't know, you not planned anything. Okay, and you are just randomly one fine day you are like, okay, I have heard this talk of Tarvin and Anisa talking, and now I got to do it, and you start doing it, and you don't have any content plan, or you don't know what you're posting, or how you're posting, when you're posting, and basically you're not planning anything. Okay, so
If
when
any,
you
sorry,
do it in that
if
way,
there are any dentists online who relate to this, can you just put a thumbs up so I know how many are struggling with this as well? Sorry to cut you there, Dr. Anisa.
it's fine. It's totally fine. So, yeah. So, what was the question, Tarvin?
So I want to
If you're getting overwhelmed with
know
content.
how.
Yeah.
Yes.
Yeah, guys. So, if you are somebody who's like completely getting burnt out with social, okay, and you feel that, I mean, I'm doing things and I'm not getting a result, Tarvin is asking if you connect, then use the chat, okay, and I can see a lot of thumbs ups, and there are quite a few
Yes.
of engagement. Okay, so now the answer is, can I find a way to remove the overwhelm by having a system to do this? Okay, and not everyone will have um, a marketing agency with a videographer who's coming in and doing all the shooting and doing all the editing and all of that. So not many
Yes.
will have the time and the resources to do that.
Yes.
And so for these kind of people, we always, and we train people live inside of the mastermind also, and we go in depth. And what we do is we want you to come in with your team. So what I would suggest is, if you are even say one dentist with say two staff, okay, or one associate, whatever, okay, you could very well train one of your staff or one of your associates to help you with this whole content marketing, okay, because a lot of content, especially on Instagram, is mostly the in the moment kind of behind the scenes kind of just kind of the content which is not even edited, okay. So all you need is you need to have someone who's going to document that content, okay. And then once you have it all, then you probably sit on a weekend and you kind of
So
just
you cannot
just
be
batch.
doing this as a single-handedly practice owner. If you're a practice owner in a dental clinic and you don't have any dental associate, you don't have any other assistant who's trained to at least take your pictures and collect your data for you, it would be very, very difficult. Am I
Okay, so
right?
I would not say it is impossible, because
It's not
there
impossible.
was a time
I
when
said
I
it's
have done
difficult.
everything on my own. So there was a time when I was doing three or four profiles on my own without any help,
Anisa, you're
and doing
the
all this.
superwoman that I know.
No, I mean, I know people who have done it, and it's not impossible. But yes,
Okay.
you're going to reach a stage where you feel, yaar, ki main, like
You
I
get
I
burnt
have better things to
out.
do. Yeah, you
Yeah.
get burnt out, because
Yeah.
you would be better off using 2 hours of your time doing an FMR case, and having a better ROI of your time than sitting and editing a reel, right? And I get it. Okay. So the
Yes.
point what I'm trying to say is that only the thing that you as a leader would have to do is only that much part what you should do ideally, and that's what I train my
Yes.
clients and my students for. Meaning, say for example, in all the content of the month, I want to definitely the content which requires my face, the content where I'm talking, okay. So for example, this live nobody else can do, we need to come and do it,
Yes.
nobody else can do on our behalf.
Of
So
course.
maybe things like, yeah, things like lives, things like where you are talking in a reel, okay. All those things you would want to batch create it. Or maybe if you are a spontaneous person, maybe you decide a schedule, okay, okay, every Monday I'm going to go live, or every Thursday I'm going to do this session, or and then you can even have some guest sessions like how we are doing it here.
But you have to be
So basically,
consistent with that once you
yes,
do
yes,
that.
yes, and
Yes.
that's the biggest challenge. Like
Yes.
like all things in life, consistency is the biggest
Yes.
challenge. So once you are basically having a system and accountability, and I would say that have a person whom you're assigning this task, and let that person be accountable and keep you accountable, okay.
Yes.
So for example, the way it works is my content team is chasing me, okay, this week's content, you need to give me that reel, or you need to give me this thing which you said you're going to give, because it's written in the content plan of the
Right.
month, okay. So that is how the it is done. And most of the times it's the staff or the associate who's chasing the principal, and then they will be, okay, fine, I have written the script, I have it all ready, and they just need to then take out maybe half an hour or 1 hour of their time, and they shoot it all, they batch create it, and then there's somebody in the team who's editing it. Or if you want to outsource it, you can do that as well. And I have
Yes.
done a mix of both. So you get these apps also, like Fiverr and all, where you can get freelancers who will do this at a fraction of a cost.
Right.
Or you can even have interns who are interested to just make a little extra pocket money, and they
Yes.
can do it for
Yes.
you. Yeah.
Yes.
So you can definitely outsource this partially, but do not outsource it completely, because the content is what you're going to connect
Yeah. You
with, and
lose
in
your
that content
personal
you want
touch.
yourself.
Yeah.
Yeah,
Yeah.
you want to
Yes.
have yourself there,
Yes.
so yeah.
So that's great. Somebody asked a question regarding about being in a remote area and technology like GPT is not. Can you have a look at that?
1 minute. So I have answered. Role of consistent IG platform is strengthening interdisciplinary referral practice. Would you like to understand your perspective? Interdisciplinary referral practice. If you could expand on what kind of referral practice you have, I'd like to answer that better. And meanwhile, what is the next question? There is a few remote areas where without Instagram, Facebook, dental technology like GPT innovations are recognized by patients as well as experienced general dentists. How could Instagram still be seeded? Okay, so what I'm understanding is her question is that where remote areas, there's no Facebook and
So how
Instagram,
do you
and where
talk about your technology? Like, let's say she's got GBT now in the clinic. How would she help promote that? I think, is that
okay,
what she's asking?
yeah, so cool. I think that's her question. So her question is, if you have cool technology, and if people in your target market are not having only social media, then how you kind of connect and spread the word?
Yes.
Okay, so the answer is, I feel that that patient might not, your potential patient might not have social media as in Instagram, Facebook, but they definitely will have WhatsApp. Okay, so
WhatsApp.
if you're WhatsApp, yeah, yeah, and if you're
Yes.
using the WhatsApp status, that round thing around your WhatsApp,
Yes.
that that alone, we have seen a lot of traction. Okay, so you have a WhatsApp number for your clinic, like a business WhatsApp or even a normal WhatsApp, but it will be dedicated only to the clinic. And then when you're posting those WhatsApp stories, you could there will be eventually people who are going to watch it, because most of the patients will be connecting through that WhatsApp number, and they are anyways in your database. So that's one. Another thing that you could do is, say for example, if there is apart from WhatsApp, say these people are on no other online platform, email is a far-fetched thing for the Indian market. Nobody needs
Yes.
email.
Yeah. Nobody
Yeah.
reads emails.
Yeah, so WhatsApp, of course, and then of course, if you want to then do WhatsApp API and you want to do WhatsApp bulk messaging, that you can do. But apart from that, holding like a offline campaign, okay, which you do. Say for example, now I got a GPT machine and I want to now spread the word about it
I
in
think
my
somebody's
community.
asking what is GBT, so I'm really tempted to
Yeah,
say it's
please.
guided
Yeah,
biofilm
please, please.
therapy. So I just sorry, I had to stop you. So let's say guided biofilm therapy is a new technology, and I'm a keynote speaker with them. I'm very happy somebody's asking, but please continue. So when you have a new technology like that, somebody's saying even WhatsApp conventional mode of phone calling still works in remote
Yes.
areas.
Yes, it does. It does. Okay. And the thing is that most of the people, you think that they are not using technology, but they are. Okay.
Yes.
And some of them are using it extensively. They might just not show it. Okay. So what I'm trying to say here is that, sorry, what I'm trying to tell you here is that you would want to have them engage in an offline event, okay, and then maybe use the power of technology to then get them onto the online platforms. So say for example, if I have say a society of around say 20-25 buildings around my practice, okay, and now I am going to accumulate these people on an offline event, either in the society or somewhere very close to my clinic, and then I talk about the GPT machine. I give some nice awareness talk, which is not boring, which is very, very
Yes.
creative. And then towards the end, I am going to probably use technology. So maybe I have an iPad with me, wherein I'm just going to take all the details or make them fill the Google form, and and maybe just quickly add them to my WhatsApp broadcast or WhatsApp list. So basically, now I have collected the data offline, and now I'm going to be doing the nurturing online. Okay, so it's always going to be, and it could be the opposite way also, as in there are people who are following online for a long time, and then you suddenly do an event and you kind of get them offline, and then you connect and you close,
Lovely.
basically, right?
That's
So
brilliant.
yeah. Yeah, so what you essentially want to do is, you want to, because it's a local business, ultimately dentistry is local, and you
Yes.
want to make sure that you're connecting with the local businesses. In fact, we do this live in the module 3 of the Mastermind, wherein we over 6 weeks period, we actually get the participants to do a live campaign.
Yeah.
And I think you have done a glimpse of this
Yes.
5 years ago when I did my
Yes.
first program.
Yes.
Yeah.
Yes.
Yeah.
Yes. I remember that was the COVID times.
Yeah. Yeah.
Yes. So
So yeah.
somebody is asking adding location on the reels. Would that help in
Yes.
reaching people of the same location?
Yes. So geotagging, it's called geotagging, and you want to have the location, if especially say for example, you're a dentist in Pune, okay, so then
Yes.
the different parts of Pune, if that location is showing up on the Instagram, then you can do the geotagging, and that really helps somebody who's searching by location. Yeah.
Okay. Okay. So now another thing. Now many dentists are actually limited in their budget for marketing. So can you give us some self-help apps which we can use ourselves to create our own content? So we could begin with that and then see if we need help outside. But there's so many wonderful apps now. If you can give us a few pointers,
So
then people who are getting new to it or who are struggling with it can start using and understand it better.
yeah, so there are tons of apps in the market. I mean, every day there's a new one, but I feel that I love the 80-20 rule. If there's one which kind of finishes, helps you with everything, then if there's one, I would definitely recommend
Canva.
Canva. And it makes a lot of sense to take Canva Pro, because then, a lot of features get unlocked, especially if you're using Canva Pro. The free
Yes.
version is also amazing.
Yes.
But Canva, for post, and if you want for videos, then InShot is there. Then you have KineMaster, you have Filmora, you have the iMovie. If you have an iPhone, then iMovie itself is there for video editing.
Okay.
And there's just so much more out there now. Of course, AI apps have come in, where you can just, with a few prompts, you can create
Tell us
content
about
in the
ChatGPT. I mean, everybody's using
yeah.
ChatGPT. So how can we use
Yeah.
ChatGPT?
I mean, now there's so much. There's Gemini, there's Perplexity, there's
Yes.
DeepSeek. So much is there. But yes, ChatGPT is amazing, and you can, just with a few prompts, you can have your entire month's content. Not only the content, the captions, the hashtags, the content ideas, and now the version 4. Of course, you can even give the prompts, and it gives you the pictures. I mean, it gives you the post
Yes.
as well. Of course, it's very AI.
Yes.
It looks very
Yes.
AI, but
But
it
I think
does.
you should
Okay.
still, I think when you take the help of ChatGPT, it's very AI, it's very robotic. You
Yes,
need to
yes.
give, you can take help. I also go on ChatGPT, but I will never copy paste. I'll always look at it as an idea and tweak it in my own personal way so I could relate it to how I want to relate it. Like we said, you create content that connects with people, and ChatGPT is not going to help you connect.
Absolutely. Absolutely. And I'm totally with you in that. So I think I lost you, Tarvin. I don't know. Yeah, I hope
Am I
I'm
here?
still there. Yeah, you're here. You're here.
Okay.
So yes, I totally agree with you. Use ChatGPT for ideas. Use ChatGPT for getting more creative ideas. But don't just copy paste everything from ChatGPT, because nowadays you can just
Yeah.
make out this is from AI. You
Yeah.
know. So yeah, and then people of course will member who's going to help you document that content, is going to be far better investment than investing in. Of course, you want to invest in technology, but just somebody who you're just training to, like, okay, fine, I'm cementing the veneers, I'm cementing the crowns, or maybe I'm doing the surgery. Okay, quickly, I can take a before 15-second thing, and then during the procedure, and then after,
Yes.
and that really connects.
Yeah.
So I would say, even if you have an agency, the agency also is going to chase you for
Yes.
content. So
Yes.
it's better that if you can do this in house.
Yes.
I mean, there's nothing like it, and with a little bit of help here and
Yeah.
there, maybe for a
Yeah.
little bit of video editing, you
Yeah.
can take
Yeah.
freelancers.
And like
You
you
can
said,
also,
little bit, like
yeah,
even those apps and all, don't over edit. I think
yeah,
we've spoken once before.
yes,
Do not
yes.
over edit. Do not make it look so commercial that a person will think like you're hard selling again.
Yeah. That's why, if you see, I don't like to do much of editing. And
Yeah.
inside of Instagram itself, you get so much of editing. I
Yes.
mean, if you go and just click on the reel option, you're going to get so many stickers and so many things, which Instagram itself gives you so many fonts and so much more, that you really don't really want to, of course, you can spend in extra editing and all, you can. But what I'm
Yeah.
trying to make
It's
point
not.
here is that that extra editing is not going to give you extra views and engagement. So,
Yes.
I mean, you might have seen that some of the most viral reels are just very simple, in the moment kind of stuff. Yeah. So that's what I mean.
I'm going to quickly just dive into Google view reviews, and we're just going to end this here
Yeah.
because I think we can go on talking, and I'm
Yeah.
very glad that
Yes.
people are still with us
Yeah.
on a Monday night. But now I'm going to talk about Google reviews. Whenever we go to a restaurant, we go to hotels, the first thing we check is Google reviews. So what makes you think that your patients are not doing that? So uh, Anisa, I think people have a reluctance in asking patients for reviews. Some dentists, they feel, oh, I'm not comfortable asking for reviews. And if they may ask for reviews, the patients are not giving them the reviews. So their Google reviews ratings are low. How to build up on that? What are the
Okay.
tricks and tips you can give them about Google reviews?
Okay. So let me flip it for you. Would you review some place if you got a mediocre service?
No,
Would you review?
no.
No. So it's always either the service sucks so much that now I'm so
Then
irritated, I want to
I
take my
want to put a
phone
review.
and I will go and put that 1 star, and I'm going to put the whole feedback kit. This is what happened. I waited
Yes.
here, and then the food, all of that. So you irritate someone that they're going to come take of course the better thing is that you want to be on the positive side, of course, and you want to wow the patient so much that now the patient literally feels obliged, okay,
Yes.
because of we spoke about the power of reciprocity the other day in with another live okay, which I did with Christopher Phelps, and he spoke about the power of reciprocity. Okay, so that means what, that I have given such an amazing service that now the patient is almost like, is more than happy to oblige and give me that review. Okay,
Yes.
so I feel it is definitely your customer service and your clinical service, of course, a combination of both. That's one.
Okay.
And then the way you're asking, okay, and the way your
Okay.
staff is also asking. So for
Okay.
example, if I am the doctor, I can't keep chasing the patients from you. It's not very, it looks very easy. So I can just subtly say, "Oh, it was great," and you can just leave your feedback, and we'll be happy. That's all I can say. But now, if my team is indoctrinated to do this like a system, then they all know that this patient is nearing the end of the treatment, and this patient has had a great experience, and now we want to make sure that we are having those conversations with this patient right from the time, he's nearing his end of treatment, to get this patient to review. The best way to do this is that, hello, Mr. So so. I mean, I'm sure that we loved having you at the practice, and there are many people who are very scared of treatment. And if you could share your experience, then that would help those people. You take the courage to visit a dentist for a problem which they are suffering from. So, would you like to help people like you reach more people and help us also serve more people? So, look
Yes.
at the change, yeah,
Yes.
in the language. So when
Yes.
you say like that, when you're going to use this kind of script,
Right.
then patients, because people want to help, right? People want to feel good, and people will oblige. It's the way
Yes.
you ask,
Yes.
it's the way you do the treatment,
Yes.
and it's the way your staff is also, doing this for you, because it's anyways, dentistry is a team sport. You can't
Absolutely.
just have, like, doing
Absolutely.
everything.
Absolutely.
So yeah, so answer is, and another thing is, out of 100 people, anyways 20 will give you,
Yes.
because the 80-20 rule applies. So
Yes.
if I am asking 100 patients,
Yes.
only 20 will anyways give me. So the next thing is, if I want 20 reviews in one day, then I need to ask 100 patients.
Yes.
So is my staff trained to ask 100 patients every day for review, so that I come to my
Okay.
20%, right? So
Okay.
ask, I always say, ask and you shall receive.
Mm-hmm.
Always give more, so that the patient is obliged to give you the review,
Mm-hmm.
and train your staff. So these are the three things.
Great. Superb. Now I know that you help a lot of dental professionals, practice owners, and you actually handhold them into marketing and managing their practices, and it's called the Mastermind class. You're beginning it soon in April.
Yeah.
I would like to tell everybody about what you do and how you help them with your Mastermind.
Right. So the Mastermind is a implementation style, hand holding, do it with you kind of a program, which is intensive. It runs 6 months of intensive training and another 6 months of hand holding. It's almost a year long journey. Six
Wow.
months program with another 6 months of hand holding. And
Okay.
basically, we work on all aspects of marketing. We also work on a lot of leadership, team, and patient journey as well, because it's just that, if all those things are not in place, the marketing will not
Right.
work. So yes, it's a and the USP of the program is definitely the peer group which is there, and the accountability, the implementation, and the peer group, because of which people get the results.
And this is
So
all
yeah,
done
that
online.
yeah, it's a 6 months online, and then we meet offline in the boot camp, which is
Okay.
included in the program.
Okay.
So we meet in Mumbai for two
Okay.
days because we've been interacting online for 6 months, and it's
Yes.
almost like a reunion when people meet after 6 months of online. So it's
Okay.
6 months of online followed by 2 days of boot camp in Mumbai, and then the program again continues monthly mastermind. So that's how it is, and yeah, people have had great journeys
I
with us, and I have
know.
totally enjoyed it.
I'm one of those ones who've had that journey. I began my
Yeah.
live presence with Dr. Anisa. I worked on it, and she handheld me in those days and told me, "You can do it, Tarveen. You can do it. You can be in front of the camera." And here I am today doing a live chat in collaboration with Dr. Anisa herself.
Thank you so much, Tarvin. Yeah, I still remember it was somewhere in the pandemic that you did that particular program. Yeah, yeah.
Yes, yes. So yeah, and you have about the book. There's a book that you've published, and I know it is not in stock. You oversold it because you yet haven't given me my copy. So what
Sorry.
is this book all about? Like
So yeah,
everybody should know.
in fact, there are 32 people featured in the book, and I've still yet to courier some of them. And the book is now I've given fresh stock for prints, but it's going to come soon. So yes, the book is called Brandent. It's called 32 Pearls of Wisdom, and it has 32 chapters. And each of those chapters is talking an aspect of branding and practice management. And towards the end, we have some visual exercises and then some Q&As with some of the mentors, colleagues, and friends of mine who have been a part of my journey. So that's how I've
Brilliant.
curated the book. And of course, you can find the details of the mastermind as well as the book in the link in the bio. And in fact, Tarvin, I wanted to ask you, you know, when you told me about what you do, I feel that a lot of doctors are struggling with getting the right associates,
Right.
who are trained. So can you tell me, like say for example, somebody in the mastermind, because people, we eventually, even if they have one clinic and one two chairs, we want them to hire an associate as they go in the
Yes.
program, because you want to eventually go in the leadership role and make sure that you are getting more work done,
Absolutely.
so you have more hands. Yeah.
Absolutely.
So how can someone, like how do you train these
So
associates and
what
how do
I
you make them
do,
ready?
so
Yeah.
basically what happened is like when I was a fresh graduate as well, I realized that, when you come out as a fresh graduate, your college dentistry and your clinical dentistry is very different. And now I think that disparity has become even more because we've got into the era of digital dentistry where the college dentistry doesn't even have an introduction about it. So what the dental graduates suffer from is when they finish their graduation and they're looking for a job as a dental associate, they're not trained to do the dental procedures that are happening. The practice owners are not comfortable hiring them because they feel they are not able to trust them. Plus, they feel they are not going to increase the revenue. So, why should I pay them a salary? So, all in all, I wanted to bridge that gap. So what I do is I do a 5 days workshop in my clinic. I have an academy called Dr. Kaur's Academy. I have these phantom head stations which I have made so I can clinically train them like they would be working on a patient. Because it's very easy to work on a tabletop model. When we actually go to a live patient, things are very different. And I feel if I can train them with their clinical skills, with their crown preparations, with their impressions, with the way they talk to the patients, with the way they portray themselves, they could be a good dental associate, which could add value to the practice owners. So even the practice owners have confidence in them and they are also feeling good about themselves that they're able to practice after they graduate. So it's a 5 days program in my clinic. I do an all day with them. I give them personalized attention. I do only 4 at a time because I want them to make sure they learn with me, and I refer them and I help them get jobs as well.
Wow.
So that's Dr. Kaur's
Awesome.
Academy, and I collaborate with other dentists as and when and other dental professions. And I think we all are a one community, and it's great to be together.
Oh, awesome, awesome. I really feel this is a gap in the market which you're beautifully solving. So I'm so happy that I'm
So
surely
how
going to
you
refer to
help?
a lot of
You're helping
dentists.
dentists the marketing aspect outside the clinics. I eventually they have to do the clinical as well. So I'm trying to help them the clinical aspects.
Awesome, 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 Darwin. It was really, really nice. Yeah, I'm sure it's going to help a lot of people to get the right associates, because this is the biggest pain point.
Yes.
So many we put out so many resumes, and I mean we are putting out so many job portals. We are putting these requirements for jobs, and then we get so many resumes, and they have mentioned great things. But when
Yes.
these guys come in, sometimes there's a mismatch between the clinical skill and what is mentioned.
Yes.
So if you are actually bridging the gap, and when they say that, okay, fine, I've done this training, and I've done this, and I know how to
I'm
use a
confident
lumber
to do the
dam, or I know how to,
procedures. Yes.
yeah, it makes a lot of difference.
Yes.
So yeah, I think it's really
Superb.
great.
So basically, thank you so much for your valuable time and insight into this world of digital marketing for dentistry. Thank you for all the doctors and even the non-doctors who've been watching us live. It's been so interesting. We went way over half an hour of our time. We were supposed to do it for half an hour, but
Yeah.
I think it was a brilliant thing. We would want to give a giveaway. So whoever has been watching us, and especially the dentists, we want to know from you what was your biggest getaway from this session. And the answer that we like is going to receive a giveaway from Dr. Anisa. So please put in your comments once I put this recorded video online. We would want to know which was your biggest giveaway. So the first one or two answers that we like, we're surely going to give you the giveaway. And also the ones who are the most active in the chat. So thank you so much. Have a good night. Have a great week
Yes,
ahead,
thank you.
everyone.
So, by the way, just to end it, Tarvin, the giveaway, I'm going to give copies of my book.
Yes.
Okay, so stay tuned, and just whoever is going to write the most aha moments and the bulb moments in this life is going to stand a chance to win the giveaway. So, with that, thank you so much, Tarvin, for having
Thank you
me
so
here,
much.
and it was great.
Thank you so
Bye.
much. Bye
Good night.
bye.
Good
Bye.
night.
Good
Bye. Good
night.
night.
Bye.
Good night. Bye.